Health transitions are defined as the purposeful, planned movement of adolescents and young adults from child-centered to adult-fragmented healthcare systems. And during this transition period, adults with special healthcare needs are often facing difficulties to obtain proper dental care services. Many different barriers, starting from low access of care, have been identified, such as a lack of support for transitioning from pediatric dentist, discharge from patient management difficulty, a struggle to find a qualified dentist who's experienced and knowledgeable, and dental insurance. Risks resulting from these barriers are dissatisfaction with care, loss of follow-up, non-compliance, and significant increase in mortality and morbidity. Eventually, this problematic treatment paradigm and unmet dental needs, which tend to rise during this transitional period, cause irreversible consequences to adults with special healthcare needs even at young age. To raise awareness of this cruciality of transitional care, we're presenting one patient who was 21 years old male when he first showed up to Complex Care Center, a transitional care affiliated to University of Rochester Medical Center. He had mild IDD with ADHD. He got services from OPWDD, and he was cognitively impaired with oppositional defiant disorder. In his medical history, severe needle phobia was stood out. His last visit to a dentist was when he was 12 years old. Though he knew there were issues in his oral cavity because of his severe behavior issues, he had a history of 2 unsuccessful attempts being in the operating room. Also, he was discharged from different dental offices due to his condition as well. When he first came to CCC, from radiographs and clinical examination, acute swelling, acute dental abscess, high anxiety, retained roots, severe gingival inflammation, and unrestorable cavities were found. Considering patient's medical and dental condition, treatment options were discussed, and a full mouth extraction was suggested by dentist, and patient strongly wanted that option. With this condition, we managed and treated a patient with special plan coordination. Until the day of surgery, several visits to CCC were arranged for desensitization. Due to his severe needle phobia, we placed IB after nitrous gas was induced and removed IB before the patient fully woke up. On the day of surgery, full mouth extraction and alveoplasty were successfully completed. After the surgery, in the next few months, a set of complete dentures was fabricated at CCC. With appropriate behavior management and care, his Franco class improved from 1 to 3, which was from definitely negative to positive. He has been very compliant with his appointments and finally found a stable dental home with proper support and care. However, a cost of failed transition was pretty brutal. The average number of permanent teeth at age between 20 to 34 is 27 out of 28, excluding wisdom teeth, while this patient has 0 permanent teeth. The loss of entire dentition at this young age will result in interference with nutrition and further problems with occlusion from the continuous ridge resorption. He had to face these deleterious consequences, and this case represents the negative result of the failed transition of dental care in this population. From this case report, it was emphasized that a coordinated and smooth transition from a pediatric-centered to adult fragmented care is critical for adults with special healthcare needs to receive appropriate level of care. Dental care is not an exception. Moreover, organized transition steps should be established to guide the dental care and transition process. Most importantly, as healthcare professionals, dental practitioners should take an active role in dealing with the potential issues before they need to be taken care of, as known as a proactive care. It is starting from a proper education on managing this patient population. Then it continues with exploration on how to broaden the scope of dental care. And lastly, a gap in literature helping to guide dental practitioners may lead to an opening of opportunities for future study. Thank you.